Actually, I think the biggest impact is that students don't think there's anything wrong with vaping. It's less dangerous than actually smoking cigarettes, and they think this is something that won't be as harmful as cigarettes. And that misnomer, and especially now we're starting to find out that they can't even figure out why it's having a major impact on young people's lungs, and I think they have a way now of hiding it. It's a part of our student code of conduct. We do have a policy on vaping, but we also understand that young people try things, are curious about things, so we also have a class that if they are caught vaping, it's not going to solve it by sending them home for 3 days. We send them they're required to go to an education class along with their parents if they are caught vaping. So even though it's a part of our code of student conduct, our goal is to educate students of the dangers of vaping and hopefully help them make better decisions. Vaping is a big issue, but it's not the biggest issue. I think vaping is sort of a consequence of the big issue, which is social emotional health. Students engage in activities when, again, they're teenagers. They're very curious and try to find other ways of fitting in or other ways of dealing with their stress. I truly think the social emotional effect is playing a major role in students doing vaping or smoking cigarettes or doing drugs, the opiate crisis or alcohol. All those things are really just symptoms of a much bigger problem. And so vaping, yes, it's a big problem, but I think it's connected to something bigger.